Good afternoon, everybody. Good evening. How is everyone doing on a Saturday? Improving fertility with natural, holistic medicine, dietary lifestyle changes, changes in your breathing, changes in your environment. How can you optimize your health to improve your fertility? That is what we are discussing here. The topic is fertility health. If you are a woman trying to get pregnant, if you're a man trying to get pregnant, as a couple, you're trying to get pregnant and looking for solutions, answers to your situation, to where your fertility journey is, feel free to connect. Welcome, everybody, and ask a question. Share your journey, your experience, what is not happening in your fertility health, what you're trying to do. That is all we are discussing here. My name is Ashish. My clinic is called Ashish Veda. We are based in central London in the United Kingdom in High Street, and I have been supporting women and couples health for the last 11 years using natural holistic medicines. So you can also ask a question based on, and I will answer, my answers are based on holistic perspective of your health. Overall, how everything that you do affects your fertility, affects your health, affects your mind affects your body affects, they are interconnected, how everything is interconnected. So the perspective is how holistic the health is, and how everything impacts everything else. So check out my website as well, ashishveda.uk. If you're looking for some solutions, answers, guides, herbal medicines, they are all available on the website as well, and these are very bespoke. I've been supporting women and patients for the last 11 years, so there have been number of cases that I've seen, and how we got results with those cases, and even where we didn't get results, how we supported those patients as well. So that's what herbal medicines and coaching and everything that I'm doing is based on. So feel free to ask a question. What is your question? What is not working in your fertility? And let's see if we can find a holistic answer. So website has been pinned, so do check out website. Also ashishveda.uk, and check all that is available, patients, case histories as well, testimonials. Check all of that information. For those who are looking for one-to-one, you can reach out and book a consultation as well. We do Ayurvedic assessment, which is natural holistic assessment, and also medical assessment, and make sense of both of them together. How the information from both sides is making sense to where your journey is stuck at present. So fertility health. Who would like to ask a question? Share your journey, your experience. What have you been told? What have you been working on? And I will be happy to answer you. Fertility is the topic here. Men's and women's fertility, equally couples fertility, fertility journey. What are you doing currently to support your health while going through fertility journey? How is your health and well-being doing? Good evening, everyone. We are talking about fertility health. If anybody has a question, anything to share, feel free to share, ask, comment. Ranu, hi. I am on letrozole, number 2 cycle, still not pregnant. Right. How else are you supporting your health, Ranu? And what are your husband's sperm numbers look like? They are all good. Your husband's sperm analysis numbers, progesterone level is low, right? And your health, digestive health, mind, your thoughts, your stress levels, gut health. I am overweight with PCOS, right? So are you working on your nutrition? Is somebody else supporting you with that? What to eat, how to eat, how to eat better? I eat homemade food and vegetarian, right? Okay. Holistic fertility, fertility questions, fertility health is the discussion here. Rano, in your case, if you are not working on your digestive health, is one thing that you should do, and also look at your husband's sperm numbers need to be on the higher side. And letrozole is given for 2 or 3 cycles max. Letrozole doesn't fix the egg quality, which is one of the things that is also an issue with PCOS, because yes, there are a higher number of follicles, but the quality of those eggs is not there, and that is fixed by fixing your nutrition. So if you are vegetarian, and how can you change certain things in your diet and nutrition, you need to see someone so that you can start working on digestive health. Metformin is just a medical drug. Yes, it helps, but you also need to work on your nutrition. So those are the things that you can do. Find a local practitioner wherever you're based, a holistic practitioner, a nutritionist, functional nutritionist, or an Ayurvedic practitioner like myself, somebody who can support you in this, and you can go deeper into what you're doing with nutrition if you are still listening. Fertility and fertility health, holistic fertility. How can you improve your fertility using holistic solutions? Natural therapies, herbal medicines. Herbal medicines is one thing that everybody is missing in their overall health as well, because people don't use herbal medicines as much, and you can use herbal medicines for all conditions. How much, it is all dependent on what the condition is and how much you can use, but herbal medicines are one of the safest options that you can use. Khadija, I'm always feel tired. What vitamins? You need to look at your nutrition first and then vitamins. Vitamins should be checked. Um, you need to have blood tests, then look at why vitamins should be required. Have you had any blood tests done? Thank you for the likes. What do you recommend? I don't recommend without you give me some more information. How would I recommend? Any vitamin supplement that you take, it should be based on the checkup. Yes, so that you check your blood and see what is missing, and then you supplement also based on your medical history. What is happening with your health? What kind of job do you do? What kind of day-to-day routine do you have? Why are you feeling tired? What is your gut doing? Is gut health not working very well? You're not eating very well, or maybe what you're eating is actually making you tired. Yeah. Salma, what is your question? Fertility health. We are talking about fertility health. If anybody has any question, let's see if few more people ask. Otherwise, thank you for those who have asked, and thank you for connecting. Thank you so much for the gifts. Any questions? Otherwise, 5 more minutes. Thank you for being here. Fertility Health, anybody wants to reach out for a consultation, check out the website, check out more information on the website. We do have guides, we do have fertility herbs that we are now sending across the world to more and more women and couples who are using these medications, who are using these herbal supplements, as they're called in certain countries. So support that you can have for your fertility health. So check those out as well and reach out for more help, more one-to-one help. So last minute questions, 5 more minutes. Anybody has any question, feel free to ask on a Saturday. Take care.